You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
My name is Dr. Guju. Mike, I'm a PGY3 here at Eastern Virginia Medical School. Along with me tonight will be our chief resident, Dr. Andrew Sandifer.
Hey, that's me over here.
Yes. Okay. So I have a PowerPoint for y'all, so I will share my screen and bring that up and I will get started. Okay, is everyone seeing that appropriately? Very good. Okay, so Eastern Virginia Medical School, located in Norfolk, Virginia. Program was founded in 1985. We give a comprehensive clinical training in all areas of physical medicine and rehab in both the inpatient and outpatient settings. EVMS is in conjunction with Centera Health Network, which is the largest health network in the Norfolk, Virginia Beach, Hampton Roads area. So we are a very large catch-all. We are associated with the Level 1 Trauma Center. So we do have a very wide and deep pool of pathologies that we get to see, treat, and rotate with at our hospital system. We can follow patients all the way from the acute setting from when they come into the door and then through their inpatient stay and then outpatient follow-ups. Like I said, we have plenty of numbers of patients with TBI, spinal cord injury, stroke, burn, neurodisease, and other musculoskeletal injuries. We learn extensively interventional procedures, electrodiagnostics, Botox for spasticity, PNO, chronic pain management, ultrasound, and a myriad of musculoskeletal treatments. And we have an excellent faculty to resident ratio. So our faculty, we have 5 core faculty and 1, 2, 3, 4, 5, 6, 7, about 8 community faculty that we rotate with. Our core faculty, Dr. Robert Atwater. She is our program director and co-chair. Dr. Mark Caramore is the most recent addition to our group. He is going to take over all of the inpatient rehab duties. He's a graduate of UVA relatively recently. So we have some new fresh young attendings coming in. So we're excited to see what he does with our inpatient side of things. And then we have 2 inpatient rehabs we rotate at the major trauma hospital, Norfolk General. And then Dr. Quilter is at the Virginia Beach location. Dr. Katrina Lesher is our pediatrics attending. Dr. Cohen is the neurologist we work with. Dr. Gershon is the private practice. He has his own private practice, PM&R, so you get a great experience to see how stuff works, not in a major hospital group, but rather community practice. Dr. Bagaris, similar situation. And then the faculty mentioned on the right, those are all our VA faculty members. And for some reason, it's just tough to get pictures of people that work at the VA. I wasn't able to find any, but they're there. Residents themselves, we are currently at 9 total, 3 per year. So I see me, PGY3, we pull from, again, a lot of our residents are from Virginia, a lot from Richmond, kind of the greater DC area, but we pull from all over. And okay, so our rotating locations, I alluded to this a little bit before, but these are our major locations. So Centera Norfolk General, this is kind of the mothership. It is the level 1 trauma center for the greater Tidewater area. This is where our 16-bed inpatient rehab unit is. We rotate on a consult service and on specifically a trauma consult service to get us very specific exposure to the acute side, where we are consulted as soon as they roll into the hospital, and we see them through their hospital stay and then through their IPR placements. Then across the street is our EVMS Andrews Hall. That is our outpatient clinic where we do the MSK pain and IPR follow-ups. Children's Hospital of the King's Daughters, it's where we rotate the pediatric hospital. Again, this is all one complex. You can see in the background here, that's Norfolk General. So all three of these are within one block of each other. So it's very nice to have them all concentrated there. A little bit further out is the Hampton VA. It is a gorgeous facility right on the water. We rotate here both on their outpatient MSK, their EMG lab, and this is where we do our spinal cord injury rotation. And then Centera Virginia Beach, this is another inpatient rehab unit that we work with Dr. Coulter. All right. I think it's good when you're looking at this sort of stuff that a lot of you've never been to Norfolk, you've never been to Virginia Beach. So to show a map of where everything is, I think is really useful. So Norfolk General, Andrews Hall, and the Peds Hospital, CHKD, right here in Norfolk. Up here at the Hampton VA is where the VA is. And this is Virginia Beach and Dr. Gershon's office. So there's major highways connecting all of this stuff. It never takes me more than 30 minutes to get to any of these places, which I'll show on the map later. Our rotations, we have 10 different rotations, 2 IPR rotations, 2 consult rotations, a spinal cord injury unit at the VA, several outpatient rotations, both at EVMS in the community at the VA. Our neurology is through EVMS Neurology, and pediatrics we have through CHKD. Our rotations are 2 months long, and you can see a breakup of the rotations based on year. So your PGY 2 year is going to be your heaviest inpatient year, and then it becomes progressively more outpatient as you progress through years 3 and 4. So this is a breakdown of what we would do per year. I won't go through it in details, but if anyone has any questions, you can take a look at this and feel free to ask. So this is our rotation calendar for this for the 2021-2022 academic year. Overall, it's 2-month blocks for each one of the locations, with the exception of the trauma rotation. The trauma consult service, let's put it out there, we are not primary on the trauma service. We are consulted on traumatic brain injury and spinal cord injuries as soon as they are admitted to the surgical ICU. So as soon as they come in and they're, Ranchos 1, Ranchos 2, we get to follow them as they emerge from that and then do very specific and detailed sign out to the inpatient rehab setting. You can continue to follow them there. So you really see someone through their whole TBI, SCI. Okay. So why Hampton Roads? You'll find that a lot of programs, curriculums are very similar. They all have a major academic hospital. They all have a VA. What really sets places apart is where they're located and what those areas have to offer. So why the Hampton Roads? Virginia Beach, it's absolutely gorgeous. It's a quick drive away. This is the Neptune statue at Virginia Beach. On the Norfolk side of things, this is downtown Norfolk. This is the water side. I went here last night for live music. Based on where I live, I was able to walk down And when I was walking down, I got to walk by this beauty. This is the USS Wisconsin. Norfolk and Portsmouth are major ports for international trade. It keeps the area young and vibrant. There's a very large active military base over in Portsmouth. So that's kind of gives the energy and the history to the city. It's not all beach. We also have some green. This is First Landing National Park, where State Park rather, uh, again is very close. So here are all the locations that I just went through. So again, Waterside down here in Norfolk, in the downtown area. This is the Ocean View Beach that I prefer to go to. Wisconsin is down here, and then the Neptune statue is over here on the left, on the right. And this is where I live, just to give another demonstration of where things are. I live right next to the hospital in the area of Ghent. It is super convenient to live less than half a mile away from where our major rotations happen and still be able to make it all the way to First Landing National Park with 32 minutes with some traffic. So everything is very centrally located, and it allows for a very nice lifestyle because I hate commutes and waiting in traffic. The food here is amazing. A lot of fresh fish and seafood from the Chesapeake area. A little bit further away, we have the Shenandoah National Park, Washington, D.C., Colonial Williamsburg with Busch Gardens, and our program coordinator, Kiara Jones. This is her email for her contact information. All right. That was a pretty quick run through of everything that I will be doing for the next 3 years, next 2 years. But does anyone have any questions that we can talk about now? Any specifics about the curriculum or the area, anything like that?
So there's been two questions, just jumping in from the chat. So first, we are an advanced program. We start after kind of our prelim year. Usually one resident a year comes from like the EVMS, prelim, medicine or surgery, or even pediatrics kind of prelim years into our unit or into our group. Another question kind of coming up the group is, where do our residents typically wind up after residency? We do have a paying fellowship within our residency. So usually one resident out of the three kind of goes into the paying fellowship. We just opened that up to kind of 2 residents. So the most recent year, 2 of our residents went into that paying fellowship as well. The other residents, a lot of kind of pain management throughout the area. I'm looking for more kind of outpatient opportunities, and have been having no trouble kind of getting job opportunities and contacting with hospital systems outside as well for that. We pretty much go anywhere. Another question is community outreach involvement in the area. With the military comes a lot of kind of outreach possibilities. You can work with the kind of adaptive sports and in the military, also with local high schools covering games and such. It's pretty easy to do if you're interested in sports medicine.
In addition to community outreach, we've been working on fostering a closer relationship with the trauma service, and they have what's starting up the violence intervention program. So oftentimes we'll see spinal cord injuries in young men due to violent crimes, and working with those social workers is something that's we plan on doing a little bit further in the future.
Another question popping up in the chat is, what's your kind of favorite part of living in Norfolk? So I actually have a 4-year-old daughter. Schools are kind of great around here, so that's actually a really good thing to have, and just looking forward to about this area, something I didn't have to worry about coming in. It's been really helpful. Also, plenty of parks, plenty of beaches. Everyone, because There's a big kind of military group. A lot of people are a little bit transitory in nature, so they're used to kind of getting out there, meeting new people. So it's not like you're going into your own kind of little cloistered area. So it's easy to kind of reach out to people. So the people are great.
Got about 5 minutes left.
Okay,
Alright.
favorite part of living in Norfolk, the food. I do love, my wife and I think at least pre-COVID, our major hobby was going to different restaurants. Downtown Norfolk, a lot of restaurants. And I live right outside the hospital in the Ghent area. It's pretty rare, in my experience, to have the area surrounding the major hospital be really nice, but that's what we have here. So I am half a mile from Norfolk General and half a mile from downtown. So that's being able to be walking distance to everything that I want to do is really great.
Mhm. So quick sense of our patient population. So the Hampton Roads area is pretty diverse uh, compared to most of the country. Also, because we're spread around the Hampton Roads area, we do get kind of different kind of parts of that kind of melting pot, if you will. So in Norfolk General, it's the level 1 trauma center. We get most of the bad trauma is a little bit less socioeconomic. Over in Virginia Beach, it's a little bit more wealthy, more private insurer paying, and we kind of deal with those practices. Also up in Hampton, which is where the VA and the spinal cord injury unit is, that's pulling from the whole kind of area there, and we get chronic spinal cords working with the population. We see pretty much every sort of. We pull from about a 3 million kind of catchment area in this Hampton Roads, so we get to see a lot of patient and pathology.
Yeah, I want to echo that. Again, Norfolk General is the major trauma hospital for the greater Tidewater area. And that does tend to catch more of the Medicaid population, whereas the Virginia Beach is just a wealthier area. But you get to see both of those, so you can really get a full picture of how medicine is practiced, and you're going to see that wherever you go and wherever you go out and practice, you may hit in one spot or another. So being able to see both of that really gives you a good overall perspective of how what healthcare looks like.
Quickly, what does didactic look like? So we kind of rotate through the main core topics, spinal cord, stroke, TBI, your orthopedics, all the fun things you'll read about in Cucarillo. Those are usually led by faculty or kind of core faculty, or also just people we can gather from the outside community. With the VMS in the medical school, we have all the good things there. So the next month we'll be spending a lot of time in the anatomy lab. We'll bring the ultrasound machine in there just to kind of see what we can see and kind of learn based off of that. We really kind of reach out to the kind of outside faculty to see what they can teach us and what we can learn from them.
We are
2 minutes
implementing
left.
ultrasound curriculum.
No. Just because we have
Oh, are we done?
looks like we've gone through. How often do residents hang out outside of clinic hours?
We do. We hang out. It's
Yeah. So we have didactics kind of every Tuesday and Fridays, Tuesdays in the afternoon. So we have time to kind of spend together outside of clinic hours. Because most of our hospitals located in Ghent, a large portion of our residents live around each other. And that's really convenient just to kind of getting together on the time. Yeah. Quickly, things that people didn't ask, call. Everyone wants to know about call and what you're doing. Usually it's kind of, we take just primary call on our inpatient rehab unit. So it's just 16 beds. So it's really not that many patients you have to kind of worry about or get called in the middle of the night. Then it's graduated. So SPGY2, you kind of take most of the call and it lessens up over the years. As a PGY4 currently, I'm almost done all my call, and it's pretty much not even. We're 2 months in.
Yeah, I have 7 weeks of call this year as a PGY3.
Mhm.
And it's home call year round on the weekends, but then you just have your pager on over the weekend.
Yeah.
It's not bad.
Yeah. No. Appreciate everyone here just kind of looking to see what's out there. Feel free to hit up Kira, and she'll get in touch with me if you have any kind of questions or kind of going back and forth about what our program's going on.